The Modified Ashworth Scale Assessment Tool is used to measure spasticity in patients with neurological conditions. In this video, we will be demonstrating how to administer this assessment. To begin the test, the therapist will place the patient in a supine position. If the therapist is testing a muscle that primarily flexes a joint, they should place the joint in a maximally flexed position and move to a position of maximal extension over 1 second. If the therapist is testing a muscle that primarily extends a joint, they should place the joint in a maximally extended position and move to a position of maximal flexion over 1 second. The therapist will then score based on the classifications mentioned in the video. Finally, they will record the muscle and joint tested along with the appropriate score based on passive motion.
Alright, hi guys. Today we're going to be doing the Modified Ashworth Scale, which is a spasticity test that we observe through passive range of motion. So the time to administer this test depends on how many joints you want to assess. But today Brooke is going to be our patient and we're going to be looking at elbow extension specifically. So the level of tone that we observe with her movements will determine what score is appropriate. All right, so now we're going to look at what those different levels of the Modified Ashworth Scale would look like if we were to be assessing a patient. So first we're going to show you guys a 0, which would mean that there's no increase in tone observed. So if we start Brooke at full elbow flexion here, we bring her straight down into elbow extension, there's no increase in tone with that movement. Now a 1 would be some slight resistance observed, specifically at the end range is going to be a little bit of a catch, so it'll be resistance through less than half of this range of motion. So if we start her up at full elbow flexion again, we bring her down, oh, there's a little catch there, but then she can go through, that would be considered a 1. All right, so the next thing we're going to look at is what would be considered a 1+ on the Modified Ashworth Scale, and so this is just going to mean that there's more resistance observed through about half of that range of motion. So we'll show you what that looks like. So we start Brooke up again at full elbow flexion and we come down. Once we get to this half range, we're tighter, but we're still able to make it to the end. So the next thing we're going to show you is a 2 on the scale, and so this is going to be an increased amount of tone throughout the full range of motion. So here we are, starting up at full elbow flexion again. We come down and it's markedly different coming through this range here, but she still makes it to the end. All right, so next thing we're going to show you guys is what a 3 would look like. So a 3 is going to mean that there's a considerable increase in tone and that passive range of motion is going to be very difficult to get through. So if we do this again of moving Brooke into elbow extension, you can see here that this motion is a lot more difficult than the 2 was. But we can still get her to the full range. There's just a lot more tone observed in that elbow. And the last thing that we're going to show you guys is a 4, and this is going to mean that your patient, the affected joint is going to be either in that rigid flexion or rigid extension pattern. So for Brooke here, if we try to move her, you can see we see that rigid flexion pattern here, and we can't get to end range. We're stopping at this point. So if your patient can't meet the end range and they're demonstrating that rigid pattern, you would know to assign a 4. And that is all the levels of the Modified Ashworth Scale.